Minister, the efforts of the Irish people over recent weeks to reduce social contact and take care when they did meet others, combined with the high uptake of vaccination and booster programme, has made a considerable difference to the public health situation, and I know that is why restrictions have been eased. We've heard from the CMO that getting back to activities is possible now, and we have much to look forward to. However, I have concerns, and one of them is about the case numbers, that people are still getting sick. Children, my understanding, are still getting sick. We really need ongoing close monitoring of the virus, because the message has to be it still isn't over. There is a sense that people now highly vaccinated or have already contracted the virus have changed their attitudes about the virus, and I'm getting a lot of hearing a lot of people talk about that in the last few weeks. But I suppose we still have to be very careful, because there is always that risk, and while the Omicron infection led to a smaller share of hospitalisation than the Delta, if you look at now where the Special Olympics in China, they are hosting the Winter Olympics, and they are taking measures to contain travellers from abroad and to avoid mixing with the population of the city. We are reopened, and this is great for our economy, for our tourism and hospitality, but we must accept that we still have a protective role here. While we must communicate that people must continue to follow the current advice for those with symptoms, those close contacts, tell them they should continue to wear masks, maintain clean hands, we cannot lay everything on the good people of Ireland who have already done so much. We must take steps to continue to protect public health. We must also maximise the uptake of the primary and booster vaccination, and we must make sure those travelling here still follow guidance, and we must boost our public health sector to catch any outbreaks which could happen. As we reopen, though, we need to look at the pinch points, and as I raised with the Taoiseach yesterday, dentists around the country, and my understanding is most of them are not accepting medical card patients for treatment. Many people have been unable to afford to pay privately, and their dental health has suffered immensely. My understanding is, again, in Carlow, there's only one dentist that is taking medical cards. Now, I think that has been a really big issue for me. But also, I've had people contact me where, and in fairness to GPs, and I understand that they've been given the vaccinations and the boosters, but they also, some of them haven't been seeing patients. And I know some patients have contacted me now that they really want to be able to go back in with their complaints and actually see their doctor face to face, while the doctors and the GPs, and the nurses and them all have been really good ringing and whatever, and some doctors are seeing patients, but there is still doctor surgeries that are not. So I would ask that that would be looked at. But also, I've had a lot of people contact me that are waiting on operations and feel now that they need to actually try and get into the hospitals to have their operations. And I know one particular lady came to me and she had to have a knee replacement, and she has a medical card. She's an elderly lady, and she had been waiting. Of course, with COVID, look, we do understand the hospitals, the way we had to be so careful with people visiting or people going in for operations, but she was told that it would be a long time before she had her operation, but she ended up going private, and the family had to try and save that money to get that operation for her. So I would say that we would look at people that need operations, particularly people who are going through so much pain, because even though now it is really good to see that we have moved on, we have to make sure that people who need operations or need to see the dentists or need to see their GPs, that they are in a position to go and see them, and that they will be seen. Another lady I had appealed to me. She was immunocompromised, and she feels that they have been left very much to fend for themselves and have had no information is being passed on to the population as a whole that might make them, think twice about, what they can do and what their concerns are. So, thank you. So I would ask ministers that would be looked for, and it is a good day that we are moving on and things are going back to normality. Thanks, Oireachtas.